Good morning. Welcome and thank you for joining us for week 7 of our Northern Light Health Business to Business Zoom conference. We're changing up our format for today. We added more expert speakers and will utilize a roundtable approach. The questions today are from your submissions prior to the conference, from you during the conference, and from our experience over the last 6 weeks of conferences. Today's topics are also more expansive and include the science behind this coronavirus, personal protective equipment and the supply chain, capabilities of our healthcare system, financial status, mental health and wellness, and communications lessons learned. Today's format will enable us to look at things from several vantage points in a conversant style. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. Before we get started, I will read our legal disclosure. Coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. In regard to employment, every situation is unique and must be reviewed on a case-by-case basis to ensure compliance with the law. The information presented should not be taken as legal advice, and you will need to retain your own counsel to review specific questions regarding employment situations and/or accommodations in your organization. We've designed this hour to offer you the most current and we believe most useful information. I invite you to directly be part of the conversation. Please use the chat function to ask questions. You can do this at any time. I'll keep track of them and have our experts respond. To see the panelists simultaneously, use the gallery view. The icon is located in the upper right area of your screen, and we started off the conference with directions. Also, to help us get a little more detail on how we can best support your efforts, we are going to email a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful, if you like this roundtable format, and what topics you would be interested in us focusing on in the future. If possible, please stay with us for my closing remarks. I will share our exciting plans for the next 2 sessions. It is a pleasure for me to introduce our esteemed panelists. Our panelists today are Jeff Doran, Vice President of Northern Light Medical Group and our COVID-19 Incident Commander. Jeff has been engaged in all aspects of our response and recovery since we launched our system-wide effort in early March. Next is Angela Felicia. Angela is a licensed clinical social worker and is manager of Healthy Life Resource Program at Northern Light Acadia. Angela has worked closely with our team of mental health experts in support of our patients and employees during these trying times. Also joining us today is Suzanne Spruce, Chief Marketing and Communications Officer for Northern Light Health. Suzanne has been with Northern Light Health for nearly 20 years and is responsible for brand, strategic communications, public relations, marketing, and web applications. She plays a critical role in all aspects of our COVID-19 communications strategy. Our next panelist is Dr. Jim Douglas. Dr. Douglas is a family physician who works at Inland Hospital and a local Waterville practice. He also serves as the Mid-Maine Medical Information Officer for our system. Dr. Douglas has been immersed in working with our teams to support testing and standing up tents across the state to safely evaluate people with possible COVID-19 infection. We are fortunate to have Dr. Jim Jarvis join us once again. Dr. Jarvis is the Director of Medical Education at Northern Light Health. He has been instrumental in our incident command, integrating Northern Light Health with the other state healthcare systems and the Maine CDC. Let's get started with a question for each of our panelists. What is What is one outstanding pearl of wisdom you have picked up during this pandemic that you would like to share with our participants? I'll make the first contribution. This coronavirus is a very simple biologic system that has a limited amount of genetic material covered by some fats and proteins. Real simple. It is perfectly designed to do one thing well, and that is to infect people. It will infect every opportunity it is offered without thought and without question. We have been very fortunate in Maine to have a low number of people infected, and therefore, we're not exposed even when we create opportunities that otherwise would result in an infection. This fact makes everything else you will hear today extremely important. Dr. Jarvis, if you would share your pearl of wisdom.
Thank you, Ed, and good morning, everyone. For me, it is about that we all need to think more critically. And what do I mean by that? Well, this virus, if it's shown nothing to us, it has shown that we do not know anything about this virus. We are learning on the go. What was the world back in December is very different than the world that's today. So when I talk about thinking critically, I'll just use an example that really didn't cause much harm, but certainly caused a lot of confusion and difficulty for individuals. And that was the meme that got out there that you had to go out and buy toilet paper. That meme said that toilet paper was manufactured in China. China was being shut down, and therefore, if you didn't buy toilet paper now, you wouldn't have any toilet paper for the future. The problem was that most of that was untrue. First of all, China was not shutting down. Certain aspects of China shut down, particularly in the Wuhan province. Also, China didn't make all the toilet paper. In fact, we make toilet paper here in Maine, right down the street in Old Town. And so people irrationally believed that and went out and did something that, again, caused a lot of confusion, consternation, and embarrassment. That's fine, but we did the same thing with some very important scientific things. Particularly, initially, there were reports of treatments that were available for COVID-19 that turned out to not only be inaccurate and unhelpful, but actually dangerous. And so my pearl is that we all need to think more critically. Ask ourselves, where did this information come from? Is it from a reliable source? Has it been reviewed by other individuals to show that, yes, indeed, it is factual? And does it make common sense? Again, toilet paper didn't make common sense because we had toilet paper, and then we didn't. And we don't want to do that same thing when we talk about healthcare. So that's my pearl of wisdom. Dr. Gilkey, you're on mute.
Thank you. Next up is Suzanne Spruce.
I think what I learned pleasantly was how resilient people are. We can quickly adapt if we need to, if we're asked to. We started working from home successfully. Some of us homeschooled while working from home with a spouse in one room and kids in another. And we adapted to curbside everything to go. But I think we also began craving clear, consistent, accurate communication. I know internally we became much less formal with things that we were doing here in favor of more frequent outreach, more reassuring communication. And externally that held true as well, with more outreach to patients and community, just trying to get accurate information out there. So I think people were resilient, but also were just hungry for clear communication.
Thanks, Suzanne. Angela, if you would share your pearl of wisdom with us.
Yes, thank you. And good morning, everybody. It's good to see so many folks on the call once again. One of the things that we've been thinking about quite a lot here at Northern Light Acadia is people's mental health and wellness through the pandemic. And one of the things that I think has been really important for us to reinforce with folks is that whatever people are feeling right now is completely normal and a normal response to these really abnormal events. So if you're feeling anxious, stressed, worried, overwhelmed, those are all normal responses to this really abnormal event. And I think that's important for us to all remember. That's sort of the way our brains and bodies work, is that we become a little bit anxious when we're under stress, and that's all normal. The nice thing is that we do have access to telehealth. I think it was Suzanne who just mentioned that we were able to sort of stand up telehealth pretty rapidly, so that if people are concerned that maybe they're under extra pressure, that you can get some help from a professional. But really my big pearl is, this is stressful. It's totally normal to feel stressed.
Great, thanks, Angela. Jeff Doran, if you would share.
Sure. Hi, good morning, everyone. You know, I have been so privileged to be asked to serve in that role that Dr. Gilkey mentioned as System Incident Commander since the very beginning. And there are so many observations and experiences I've had with so many of our colleagues across the system that there's an ocean full of pearls that I could share. But if I was to sort of characterize my feelings about the pearl, I would say, embrace the challenge and respect the science. And with that, I mean, you know, we have had to take a can-do attitude as a health system. And it's just been so impressive and inspiring to see our folks step up to the plate and throughout this entire ordeal and to this very day, just embrace this particular challenge. And by respecting the science, it maybe refers back to the mental attitude that you need to have to persevere both professionally and personally with our families and the struggles we're all enduring. So I would characterize my pearl as just embrace the challenge and respect the science.
Thanks so much, Jeff. I'm going to actually keep that one in front of me throughout this whole thing. Dr. Douglas, if you wouldn't mind sharing as well.
I'd be happy to, and thank you everyone for joining us. To reflect on some of the other pearls that have already been mentioned, it kind of comes down to flexibility. Throughout this entire pandemic, it's affected our community in multiple different ways, and we've all had to learn to be extremely flexible with the changes that we've had with these stay-at-home orders. We've all learned to have to, moms and dads have had to learn how to take care of their children and education. Providers, first responders, and even employers have had to learn how to be extremely flexible in this situation. So my big pearl is to maintain, as Jeff had said, you know, embrace it, stay flexible. We do have to be able to change, because our status may change from being open to having to wear masks to having to, at times, perhaps in some locations in the country, potentially even consider slowing down a little bit to protect patients. So we all need to maintain that flexibility.
Great. Thank you, Jim.
Thank you.
So I'm going to ask a question of Jeff. Please give us the big picture of where we are in our readiness. How prepared is our healthcare system? And mention the financial status and the federal money. So quite a bit there. You're on mute.
So thank you, Ed. I'll try to put together my thoughts very quickly here. So I would characterize as a health system our readiness. I am highly confident with all of the work we've done and all of the thinking and thoughtful measures we have put into place. And the fact that we responded so quickly from the get-go in preparing for this pandemic. And we went into it with a long-haul lens. I feel very confident that not only are our you know, hospitals and practices, et cetera, prepared, we actually are familiar with and have worked forever in the world of infectious disease. We kind of know, you know, what it takes to be safe and support our patient cares in those environments. The magnitude of this, of course, is unlike we've ever experienced. So we went into it with an advantage. And not only did we know how to take care of infections, et cetera, in the forever, but we've got expertise in our facilities and in our system that we tapped into. And we're so fortunate to have, whether it's the infectious disease expertise, whether it's our clinical engineering expertise, whether it's our environmental services expertise, our supply chain expertise. We have a number of very bright, well-educated, motivated folks who have given us every reason to be as confident as we can be going forward. Now, that being said, we also still struggle, as the rest of the country does, with PPE, supply chains and sources, but we've also made tremendous progress in securing those assets as well. We still worry, so the worry still remains. And we're going to continue to stay very diligent, and plus the innovation that we've established and the relationships we've established with so many of our community partners, whether they be businesses or whether the communities themselves, in shoring up our responses and preparedness. So that I feel very confident in sort of where we stand today. Surrounding our financial well-being, you know, there's not a person on this call who represents themselves personally or from a business standpoint that hasn't felt the real stresses and strains of the financial implications that this pandemic has caused to us. It's very, very difficult. We've been very fortunate, and we're very thankful as a system and as a healthcare industry that we've been able to receive some support, some grant support from the federal government through the CARES Act. And so we've been benefiting from that, although it's just helped in our cash flow. We made the tough decisions, as all of us across the nation did, in closing our elective surgery down some months ago, and that really took a big chunk of our financial well-being away. These funds are not nearly sufficient to cover for those losses, but we're holding our own, and we continue to find good trends in our recovery, business recovery, but we're coming from a very big hole that we all, that was dug for us. And I know all those on the phone who represent businesses are also feeling the exact same experience. So, but we're still doing fine. We just made the tough decision not to lay off our staff. We participated in voluntary furloughs. So we knew we made those kinds of financial commitments in the interest of our staff, as well as our communities and the economic health of our communities. So we made some of these decisions, and we're going to continue to work hard to work our way through them.
Thanks, Jeff. I'm going to build off of that by asking Dr. Jarvis a follow-up question. So, you think about where we are with the case rates, the hospitalizations, the death rates in Maine, and, a lot of people are getting back to their lives to varying degrees, businesses opening up. Could you just give us a little bit more insight based on the work you do week in, week out at a statewide level about how prepared we as a state, including Northern Light Health as a significant participant in that, for a possible surge that could still occur?
And that's great, Ed. And I think closing with that is important, that we still are in this pandemic. And while Maine has done an excellent job in keeping the overall infection rate for our citizens and visitors to the state low, that could change at a moment's notice. Just look around the country where you see states that either had it under control or thought they had it under control, and then all of a sudden had a ballooning number of cases. The good news is that Maine is very well prepared. Very early on in the pandemic, the state of Maine, as well as the large health systems in Maine, decided to work collaboratively and not in competition with one another, and that continues to this day. In fact, this morning I had a meeting with the other three large health systems in the state of Maine, just to talk about where things are and where we think things are going, and to make sure that we are talking to one another. Here in the greater Bangor area, Northern Light Health Eastern Maine Medical Center, St. Joseph's Hospital, and Penobscot Community Health Center, in collaboration with the city of Bangor as well as other agencies, immediately took steps to make sure that we were prepared, that we could have the appropriate hospital beds, that we had the needed equipment, and in fact built the very first testing site for this part of Maine, had it up and running, working with all of those together. That is just one example of how we have worked collaboratively. There are many more. We continue to share information and even share medicines. The drug remdesivir, which has been shown to be effective in helping people to remain off of ventilators when they have serious illness. we actually have a statewide mechanism for sharing that medication across hospitals if need be. Again, these are all the little pieces that we do. But we still need to remain diligent. We still need to slowly reopen our economy. We need to continue to monitor as we do so, because if we do have an outbreak, we need to be prepared to be resilient and also to be responsive, and even need to shut down if need be. So thank you for that, Ed.
Yeah, I think that's really important that collectively in the state of Maine, we can function in a very collaborative way. So that's excellent. Next up, we're going to try an audience participation. Lainey, if you can help us out with that, we're going to ask our participants a question. Why are you participating today? And we'll just give, you know, probably the better part of a minute, and Lainey will select when participants have answered. I now realize we do have a reality show going on here. Don't be shy, vote. Okay, we'll give it a couple more seconds, Lainey. Okay, great. Well, thanks. So we see that we actually have a fairly large spectrum. The predominant answer has been, I want to learn as much as possible. And I think our design today really does meet that need. And then, like many of us, when we go to a conference, most of what we hear is a confirmation that we're actually doing the right stuff, and that's very helpful. And then others are interested in what's going on. It seems like everybody is out of the gate for the most part and getting started. So I think the information that we're targeting today seems to be on the right track. So thanks for that, Lainey. My next question, back to Dr. Jarvis. Everyone is hoping for a vaccine and treatment, and I realize that this is really quite a dynamic situation, changing certainly weekly, if not daily. So could you comment on where we are for a possible vaccine to start, Jim, and then I'll follow that up with a treatment question.
Sure. So right now, there are many companies around the world that are working on a vaccine. Unfortunately, typically for vaccines to come to fruition, it usually takes anywhere from 3 to 9 years to get through the process of, one, designing that vaccine, and two, making sure that it is both efficacious and safe. There are several companies who are already reporting that in phase 1 trials that they have found that that their vaccines have produced an immune response to the vaccine itself against the virus that causes COVID-19. So that's very encouraging. However, before something comes to market, we usually have to go through 3 phases of trials. So it's a ways before that happens. But we are encouraged, and the fact that there is lots of money and support around developing this vaccine, we are hopeful that it will shorten that time course that usually takes to bring them to market. And when we do, I will share that the state of Maine is well prepared to be able to get that vaccine supply out into our communities. Again, as I talked about earlier, that all of the state health systems, along with the state of Maine CDC, have been working collaboratively, and this is another area where we have been doing so. In fact, we are already trying to be strategic about the influenza season that's coming up very shortly to make sure that we can vaccinate all the people in Maine against influenza, because what we don't want to see is to have influenza and COVID-19 happen at the same time. And so good news on that front as well.
So great. I'll make a comment myself on vaccination. I think all of us are trying to figure out from a consumer point of view the information that's shared with us, throughout the day and on the evening news, and really trying to understand what information can we trust, what sounds political, and it's very difficult. But from a scientific point of view, one of the things that I found very heartening is the methodology to do the early stages or phases of vaccination evaluation. And what they've done is, instead of the traditional approach using eggs that require a lot of time to develop culture and takes up the lion's share of the time in the early phases of it, they're using a modified adenovirus, which is a very safe way to do it, that allows them to effectively have cut down 6 years worth of work down to 6 months. And I find that very heartening that we might get this across the finish line a whole lot quicker than, all the different numbers that we've heard bandied around. So that's a good thing. I'd also reinforce the idea that we know at the federal level we have Operation Warp Speed, and we're understanding that there's been a lot of money thrown at the vaccinations and trying to get all of the ability to give these vaccinations to everyone when that vaccination gets approval. I certainly feel very assured that Northern Light Health, as well as our statewide system that Dr. Jarvis was talking about, is ready to go at moment's notice. So we're ready to hit the ground running on that. So I'm going to switch gears a little bit and Dr. Jarvis, ask you a follow-up question on treatment in the same vein. Give us the state of the art, if you will.
So again, just to remember that most individuals who get infected with COVID-19 either have minimal or no symptoms or moderate symptoms, and most can take care of themselves at home, maybe with some guidance from their healthcare provider, particularly if they have other chronic illnesses. But those people who have moderate and severe illnesses that require hospitalization, there is some promise for them as well. So remdesivir is the one drug that we've talked about. It's an antiviral medication, so that means that it affects the virus itself. And that has shown some promise in keeping people who require high levels of oxygenation from requiring further levels, including needing to go on a ventilator. And so that's encouraging news. Unfortunately, it has not been shown to decrease the rate of death, but we are hopeful that as we make tweaks and changes to the protocol, that maybe we'll see that as well. Also recently published was information that a steroid called dexamethasone can also help to keep people from needing to have further severe treatment for COVID-19. And then recently, as this morning, there was reports that maybe it's not just related to dexamethasone, but other steroids that we use in a clinical setting may be effective as well. So that's good news on the front. There's also other things that have been going on, talking about different techniques that you can do for particular individuals who are sick with COVID-19, trying to keep them from having to go on one of those ventilators. Because unfortunately, what we found is that once a person is requiring mechanical ventilation, that it is very difficult for them to recover. Though even today, we've seen some anecdotal evidence in the news that even those individuals are doing better. And as we see across the country, the rate of death from this virus is actually going down, even though the cases are going up. And that's because we're so much smarter than we were back in February, April, and March when the pandemic first hit. And so while rates of infection are going up in particular states higher than what New York's seen, thankfully that the death rate is lower than what New York State saw initially. And again, that's because we're learning as we go and have much more evidence about things that we can do that safely and effectively can treat this virus. So thank you, Ed.
Well, thanks, Jim. So, you can get the feeling how dynamic this information is. And for those that have participated over several weeks' time, Dr. Jarvis has given us a variety of different updates like this. Suzanne, considering this dynamic information, what does it take to communicate it to avoid information overload for employees?
Oh, for employees and everyone, information overload is a real thing. I'm often asked, how often should I communicate? Is email the best mode of communication? I think you communicate when you have something to say. And if you don't have something to say, don't spam people. A lot of people feel the need to just be out in front. But if you don't have something worth hearing, then people will begin to tune you out. I think it's good to take a regular inventory of what you're hearing from people, because before you communicate, you need to listen. In order to give people the, I always like to say news you can use, because that's what people are looking for right now. You need to listen to what people want. During the last several months, we found that people were looking for easy posters that they could hang up, how you wear a mask properly, the pros and cons of face coverings. And so we tried to make that information available both to our employee population, as well as sharing that information to our business community, who was also struggling with many of these same issues. So I would say, to be a good communicator, you have to first be a really good listener.
I love that, news you can use. That's a great dictum to follow. I'm going to switch over to talking a bit about testing, and I realize that we could spend easily a whole hour, if not a half a day, on this. So, Dr. Douglas, you have a full range here. So there's been a lot of news around testing for everyone, and it has really gotten quite confusing. So where are we in Maine regarding universal testing and the standing order that the governor has issued? And please help us to understand the current testing guidelines. Include employees who visit other states and are returning to work in Maine. So that's an important part with, vacation season upon it. And I'll note that we do not have any insights on paying for people in quarantine. So we're not actually going to address that issue at this setting. So take it away, Dr. Douglas.
Thank you very much. What I'd like to do is initially give some background into the history of our testing and how we have progressed here in NLH and in the state. Initially, when the pandemic first hit, there was a significant lack of testing available. And so we started off with what we called Tier 1, and we started testing individuals that had were critically ill, or first responders, or people that were in congregate housing type situations that were symptomatic of COVID. We all know what happened at the nursing homes, and those were the people that we prioritized. The second was then we were able to expand testing to those that were symptomatic and had chronic health conditions, such as diabetes, heart disease, or immune compromise, and we called that Tier 2, and also over age 60. I'm very pleased to say that we have now expanded their testing to everybody that is symptomatic to COVID. It was so important to be able to test all these individuals that may have had COVID to be able to confirm whether they had COVID or not. So that includes, it's Tier 3, which means everybody else that's not in Tier 1, Tier 2. Now what's happened is the state, and this is great that we're going to be able to expand our testing. The state has put out what's called the standing order, and they have defined utilizing resources that they're going to help supply in the testing, individuals that are asymptomatic, don't have symptoms of COVID. They do have some individuals, some language in the standing order that talks about individuals that are asymptomatic that have had significant exposures that include our first responders or congregate housing and stuff like that. Those are actually individuals that NLH would take care of in our own workflow process. For the state expanded standing order, and I've confirmed this in conversation with the state, that it wasn't meant for anybody to get a test anytime for any reason. It's actually, they do have some criteria associated with it, such as individuals that are increased risk of exposure, and individuals that have traveled to states that have a higher incidence of COVID than what we do. So that people right now, the criteria is that if you travel out of state and then you come back into the state, you need to quarantine for 14 days. And unfortunately, that's really pretty tough. So what we'd like to be able to do is test those individuals when they come back into the state, or within 72 hours of returning back to the state, so that they can return back to their normal lives, their normal employment. And so what we've done in conjunction with the state, we're ramping up our abilities to test all these individuals that meet these certain criteria. Again, employers that, migrant workers, employees that have frequent contact with the public. These are all individuals that the state order covers to get testing. So it's going to be a staged process. As the state is able to ramp up their testing capacity, we will try to and will match their increased capacity to be able to test more and more individuals that are in and within this new state order. A lot in there, but again, it's great that we're at where we're at now in our testing capacity. And hopefully we will get to the point that if you want to test for any reason, we'll get there, but we're not there yet.
Yeah, we're not there yet. Yeah, let me just follow up a little bit more on the traveling. So you think about employees who live in Maine, work in Maine. Their travels may include, Vermont, New Hampshire. Those would be fine to come back and go right to work, correct?
That is correct. That is correct.
Yeah. Now, how about somebody who goes to Florida or Texas, which we see on the evening news or the current hotspots?
Yeah. Those individuals, either they get a test within 72 hours of leaving Florida or the hotspot and then be able to come back and demonstrate that they are negative, or that we have the ability now with the state order to test individuals. When they do come back, they do need to quarantine until they've been tested and they've demonstrated that they have a negative test. And once they have a negative test, then they do not have to quarantine any longer.
So just to take this a little bit further, because I think people are thinking a lot about testing. So if you think about the testing, if a person was exposed, let's say in Florida at an open environment, people were to varying degrees wearing their masks or not, they hop on a plane and come back, and tomorrow they're back in Maine and they get a test. Or maybe they even got a test just before they left Florida on the way through the drive-through or whatever is available in Florida. Considering that the average person who is exposed to COVID develops symptoms 4.5 days later, and we're thinking that the maximal shedding of virus where they can infect others is during that time, those 4.5 days. Help us understand the limitation on the value of the testing while not discounting it completely as a logical approach.
No, you're totally correct. When you're being tested, you're testing to find out whether you have the infection at that time. You may not be shedding the virus to get a positive test within that time frame, as you're mentioning. So what we can do is hopefully within 4 to 5 days of exposure, you're absolutely right. You're going to be starting to shed virus, and the test, even if you're asymptomatic, should hopefully be able to tell us whether you have the infection. So being able to test when a person returns, you're going to catch most people. But there's always a potential chance that we may not catch everybody with the testing.
Yeah, so that's really important. And a person could test negative today and test positive tomorrow, depending on where they are in that cycle. So it does show the limitation. It also reinforces the need to do those other 3 things, which are, wearing a mask or facial covering, right? And hand washing and social distancing. So that, I think we're all kind of annoyed hearing those 3 things at this point, but they're critically important in terms of the overall management in our way of making things safe and making sure that we can keep our infection rates pretty low in Maine. So thanks, Dr. Douglas. I know that's a broad period. Go ahead, add on.
Yeah, just want to ask, it's one other important part of this is that,
sure,
and for our employers that are on the line, is that to maintain some sort of screening process and and also to continue to educate your employees, I should say, that if you start to develop symptoms, don't come back to work. So those individuals that have traveled outside the state and they've had a potential high-risk situation, and they start to develop symptoms, don't come to work. And also into contact with their employee health, or and then also just making sure that continue, not only just for travelers, but all employees to have some sort of screening process when they're coming to work. Are you symptomatic or not? Taking temperatures, there's some people still recommending temperatures when you arrive. And we may be going away from that a little bit, but that will help protect your employees and your business.
So one of the things we do in my office is we answer 2 significant questions, and then we actually are still testing the temperatures, and the magic number that we're using is 100.4. I think in the next couple of weeks we may change our mind about that as new information is becoming available. But could you just touch on just quickly the symptoms and include anosmia type of symptoms?
Yeah, so the list of questions that are associated with COVID, it was originally just like 2 or 3 questions, but now it's fever, fatigue, runny nose, sore throat, cough, shortness of breath, nausea, vomiting, diarrhea, and diffuse body aches. Those are all considered potential symptoms of COVID. The people that are severely ill have a tendency to have more of the symptoms of shortness of breath, cough, fever. People with milder illnesses have more of the fatigue and malaise and those kinds of more milder type symptoms, and not even necessarily the fever or the cough for some people that have mild illness. So you can see that's a pretty broad list of symptoms. And there's one extra also kind of just really specific for COVID right now is a new loss of smell or taste. That is also a symptom of COVID. But so that's the list of symptoms. You should, it's clearly listed in the CDC website. So if any of your employees start having these symptoms, COVID should be considered.
Yeah, and stay home.
That's right.
Yeah, I'm going to follow up with Dr. Jarvis on a question here. One of the things I picked up recently is that as much as 60% of community transmission may be from asymptomatic people, recognizing that asymptomatic people may include pre-symptomatic, but not exclusively that. Could you comment on what you're picking up on that?
Yeah, so that's very true, and that's again the reason why this virus is so effective in spreading very, very quickly, particularly in congregate living situations like long-term care facilities, nursing homes, prisons, and shelters, because people cannot have, may not have symptoms, but there's enough virus being produced by their body that they can actually infect someone else before they're symptomatic. And that's what we're seeing. And in fact, data now shows that it's probably more likely that you would get infected by somebody within your own household than you would by visiting your healthcare provider or even going out into a supermarket. And the reason behind that is that we get lax when we're at home with our relatives. We feel that they are safe, they are our friends, they are our family. And so we let our guard down, we stop doing social distancing, and we take our masks down. And then if within your own household, if someone were to contract the virus out in the community and come home and start shedding the virus before they have symptoms, no one's wearing masks then, and you're in close contact. Sharing use items like telephones and keyboards and computers and things like that, as well as sleeping in the same room, all of that would put somebody at high risk. So it is more likely that you'll catch the virus from people who are not symptomatic, which is again the reason why we're really talking about wearing those masks or facial coverings all the time when out in the community, because no one knows who has the infection and who doesn't. We don't wear a big red star on our shirts that say, hey, I'm infected. And so we need to use all the precautions at hand for us to do that. And in fact, we know that social distancing, wearing face coverings, and doing good hand hygiene are the best ways to prevent getting this virus and spreading the virus so that we can get back to a new sense of normalcy.
Yeah, so those basics are really critical. Yeah, thank you, Dr. Jarvis. I'm going to switch gears over to Angela. You mentioned in your opening statement that frustration, worry, and even anxiety and depression are all normal during this time. How would a person know if these feelings of anxiety or depression had gotten more serious or turned into something a person should worry about?
Yeah, that's a really good question. Obviously, as I've been listening to the discussion, and maybe this is true for others, right? The more I hear about the discussion, the more I read on the news, that I even find myself getting a little anxious, like, oh my gosh, did I wear my mask correctly the last time I went to the grocery store, that sort of thing, right? And again, that sort of just sense of anxiety around, gosh, I want to make sure that I'm taking these precautions correctly is, again, totally normal. These are really extraordinary times, so we're going to be anxious. But if you find that the way you're feeling is sort of interrupting your ability to get your job done, to interact effectively with your children or your family or your friends, you're finding that you're really having a hard time getting out of bed in the morning, or you're having a hard time sleeping. Anytime these feelings are impacting your day-to-day functioning, then that's a time to be a little bit concerned. And I always recommend people just start with their primary care provider. That person's going to know you. That'll be the healthcare person that knows you the best. They can do a screening tool. That primary care provider can really be a good asset. If you're experiencing any trouble with day-to-day functioning, that's a sign to say, hey, I better reach out and check in with somebody else about this.
So I'm going to kind of go in a slightly different direction. Dr. Douglas, in your practice, what are you seeing in terms of the impact on people, from an anxiety and depression point of view? And while you're thinking about answering that, Lainey, if you could get audience participation 2 up for us. Dr. Douglas.
Yeah, there's no question that we live in interesting times right now. For a multitude of different reasons, people are starting to feel fairly stressed. I do see patients that will express to me that they're very frustrated that they can't move on with their normal lives, that they want to be able to go out to dinner. They want to be able to socialize with their friends. They want to be able to spend more time with their family. They want to be able to hug their family. They want to be able to kiss each other on the cheek. These are all the normal things that we're not necessarily able to do anymore. And so we have to give reassurance and support these individuals. This is, the ability to come in and see us, but also the ability to have Zoom telehealth visits, and to be able to reach out and touch these individuals, and to make sure that, as was mentioned earlier, that if there's more severe symptoms of depression and anxiety, that we might be able to help and intervene. But being able to talk with one another, to talk with not only with the professionals, but to maintain contact with their families, to utilize a Zoom or Skype or whatever it is to have communication, to don't shelter in and isolate yourself, not to be completely afraid to live life. As long as you're practicing the good measures that Dr. Jarvis has mentioned, you can participate and do things. Get outside, enjoy the warm weather, the sun. These are all really important. So it is expressed. People are feeling it, and those are the basic tips. But also, contact the providers if things are really impacting your daily life.
Well, thanks, Dr. Douglas. Jeff Doran, from a workforce oversight, I mean, you're immersed in all aspects of our businesses. What's been your observation in terms of, the anxiety, depression of people?
Well, there's no question our staff is just like any other resident and citizen of the state of Maine. Certainly those staff who are not clinically oriented are most notably the ones who have, had to work their way through the, anxieties and concerns of returning to work. And yet we have really put a lot of effort into the measures that we put into place back in their respective environments, their work environments, to reassure them that we are and continue to be a safe environment in which to return. We've got a lot of focused efforts at every single organization to modify the environment, reinforce, all of the other protective measures. But one thing that I just would like to note is, we all mask every day, all day, in the environments in which we're supposed to mask. And that means we're contributing to protecting our fellow colleagues to stay safe. And that's the message of masking for the benefit of making sure you don't infect others. So I think we've seen a tremendous amount of compliance. We know there are opportunities to, maybe strengthen a little bit more in some settings and in some circumstances, but we've worked that hard, and we also augmented it with the kind of services that Angela represents on the behavioral health side, and allowing our staff access to those services to support those, because they may be not only struggling coming back to work, but just certainly within their own daily personal lives.
Great, thanks, Jeff. Dr. Douglas, if you would take a look at the chat room, are you able to do that?
I'm doing it right now.
Okay, so if you would think through that, recognizing that Connecticut and New York are not what they used to be, which is a good thing. I'll make comments about the polling that we've done. So we've asked you, are your plans complete to reopen your business? And it's interesting, the question was designed to see like a progression towards the final where all work has been completed, opened, or ready to go. So that's awesome. That helps us to understand that Many of you are looking to reinforce that you're going down the right path. There's not new information to adjust what you're already doing. And then for those in the other category here, they're putting final touches on the planning. So that's awesome. That helps us a great deal to make sure that this stays very relevant for you and the kind of things that you're interested in. So thanks for participating in that. Okay, Dr. Douglas, if you wouldn't mind comment on that last question.
Yeah, thank you very much for the question. There's a couple different parts of this. I think it's great that it looks like they're going to be very, very safe when they're going out and about, and they're going to wear their masks. So when you say they leave for the field with plenty of PPE, I'm assuming that's mask, but if they're having contact with individuals with potential COVID, obviously full PPE would be indicated. When they're in the state, I do not see an indication that they would need to have weekly testing. That right now the criteria, as long as they're following good criteria as far as isolating or not necessarily isolating, but keeping themselves protected with the distancing, the social distancing, mask, good hand hygiene, and they don't develop symptoms, then I don't see a need or indication for weekly testing. However, when they do return to the state, if it's not one of our states that have been allowed that when you return, like from Vermont, you don't need to test, you will need to test.
Okay, great, thanks. Dr. Jarvis, I have a question for you. Is it okay for a person who self-identifies as high risk to return to work, such as teachers? And follow-up questions include, what about someone we know is high risk, but they don't say anything? Help us to understand the risks to the employer and the employee, if you will.
So unfortunately, this is one of those things where it really is the individual that needs to make that decision. And so what my recommendation is for my patients who are at high risk is evaluate the situation that you're going to go into. So when it comes from an employment standpoint, has the employer done the things that are necessary? Have they instituted a reallocation or redesign of workspaces so that everybody can remain 6 feet away from one another? Have they instituted a policy where all visitors, staff, guests, clients, customers are required to wear face coverings when entering into the facility? And then from an employer standpoint, have you done all of those things? You want to keep your workforce safe so that you can keep your business open. And so thinking about it from that standpoint sometimes helps people get away from the political statements that people think face coverings are, or even just talking about COVID-19 in general. If you look at it as this is simply an economic and a workforce development, then it becomes a lot easier for us to redesign our workplaces to be safe to our employers and our employees, and then safe to those that visit us in our institutions, whether that be a school, a retail business, restaurant, or whatever. And then lastly is just reinforcing that if you don't feel well, to stay home. If your employer is one that is not does not believe in that kind of philosophy, then yeah, I would think twice about entering into that facility, because not only you're putting yourself at risk, but you're being put at risk by other employees who may be encouraged to come into work if they're ill. As an employer, I think your responsibility is to remind people, if you're feeling unwell, stay home. Most employers now have figured out some way that their employees can stay active and work remotely from home. And this may be an opportunity actually to decrease your costs by having people who are ill still be able to work from home, even though normally they would be taking a sick day. So those are the things that you think about. Those individuals who are immunocompromised, they may want to have a discussion with their healthcare provider as to whether it's safe for them to return to work in whatever their particular environment is. Great question, Ed.
Great, thanks, Dr. Jarvis. One of our participants asked about the utilization of FAR UVC in schools and other businesses. So I'll grab that to try to provide an answer to that. So this is ultraviolet light C, which is a very specific wavelength, 222 nanometers specifically. And the thought is that it kills very small biological particles like viruses and coronavirus in particular, while not harming human tissue. So you could see if we could actually bathe an environment with that, perhaps we can make it safe, and it is germicidal. The problem with that is it does not have FDA approval at this point, because the studies have been done while on coronaviruses, not this particular coronavirus. So they can't actually issue an approval for that. And they don't know yet for long-term exposure, let's say 6 and 8 hours at a time, bathed in the environment, what the effect will be without the studies that are needed. So I think while people are buying these products out there on the market, and there is traction going on, it's not FDA approved at this point. We need to look for that to answer that in the affirmative ultimately, but something to pay attention to. The next thing I want to do is
Ed, I just wanted to chime in. That's exactly where you again need to think critically. Who is it that's offering this product to you, and why are they offering it to you? And have you heard in good resources that this product is something that is safe, and effective? There will be lots of people who will try to use the pandemic as a way to make money, and so I need to use caution when purchasing anything that's new.
Okay, so we're running short on time, and I want to get to round robin. I have 50 million other questions to ask everyone, but having said that, if everybody would take about 30 seconds, it'll leave time for important closing remarks. So round robin, panelists, we've been immersed in learning about COVID-19, planning for its impact, responding to its impact, and collectively trying to keep everyone safe. From your unique perspective, what do you want to make sure our participants understand about this pandemic and safely reopening businesses? So if I could start with Angela.
Yes, thank you. And thanks for everyone participating today. One of the things I think is from the mental health and wellness perspective that's so critical to remember going forward in this pandemic is that we don't have a solid end date of this crisis. So we really need to be practicing good self-care every single solitary day. And that's going to depend very greatly depending on the person. You know, some people really, self-care is going for a run. Other people, it's sitting quietly and reading a book. But doing something to take care of your emotional self every single day is equally as valuable in this time period as making sure we're doing those things to take care of ourselves physically as well, so that we can really sort of keep up our mental muscle strength to sort of move forward throughout this crisis.
Well, thank you, Angela. Jeff, if you would weigh in 30 seconds.
Sure. I say this with all due humility in my leadership role here at Northern Light, but I believe Maine is so blessed to have so many Northern Light Health colleagues living and working in all of the various communities we have who care deeply about our collective health and well-being, family, friends, and neighbors. And they continue to come to work either virtually or in person, some risking every day this direct interactions, and but yet continue as tirelessly and as fatigued as we all are and have become. They haven't stopped, and we're going to continue. We are in it for the long haul. So I am just so proud to be associated with this organization.
Well, thank you, Jeff. Suzanne, 30 seconds.
I think it's important to remember that this can also be a good time for innovation and positive change. And we've learned so much, we've tried so much new, that I hope that when we return to normal, whatever that is, that we remain flexible to new work environments and new modes of communication, and we don't let go of all the new lessons we've learned and the freedoms that we've been allowed to develop.
Great, thank you. Dr. Douglas, 20 seconds.
20 seconds. We are all working extremely hard to care for our community and to keep them well and safe. We've developed in a very short period of time means to help take care of our patients, such as telehealth, and we've also maintained it and keeping very safe environments to help see our patients in person. And you should all know that we are doing everything we can to expand and maintain our testing for COVID-19 to help combat COVID-19.
Thank you, Dr. Douglas. Dr. Jarvis, I guess you're at 10 seconds.
I will be short. Be kind to one another. Remember, we all stand together, just 6 feet apart.
Great, thank you. So I'm going to go into closing remarks. Thank you, panelists. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. We hope you have found the last hour a good use of your time, and you'll be able to identify some useful tips to apply to your business. Based on your survey feedback, we are going to be offering specific focus areas over the coming weeks. Next week, our Zoom conference will focus on reopening schools with experts from across Northern Light Health and beyond. Our moderator will be Karen Hawks, Vice President of Operations at Northern Light Health Beacon. She's a school board member and a parent of school-age children. She intimately understands the issues you, your employees, and your customers face. The week after, on August 6th, Dr. Nirav Shah from Maine CDC will be joining us. Lots to look forward to over the coming weeks. We will send you the link along with the topics for week 8. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine safely open back up for business. Thank you and have a good afternoon.